Lastly, now that we've learned all the ways that a trauma system can be used and the benefits of it, let's take a step back, go upstream, and talk about injury prevention. How do we avoid trauma in the first place? Injury prevention consists of the intervention that prevents or reduces the likelihood of injury or death. Injury prevention is the responsibility of all trauma team members working in collaboration with the community. The organization of these efforts begins with effective leadership. Each trauma center must have someone in a leadership position who has injury prevention as part of his or her job description. In level 2, 3, and 4 centers, this position may be filled by a trauma program manager with a specific role in prevention efforts detailed in the job description, but only if this role does not negatively affect the work product of the trauma program manager. For the state of Montana, a designated injury prevention coordinator is only essential for a regional trauma center, though desired for any area trauma hospitals. Key elements of an effective injury prevention program. Target the community. Identify the primary causes of injury and death. Work upstream. Identify the root causes of injury and its contributing factors. Choose pre-existing, proven, or promising programs. Understand that new program development, assessment, and implementation are complex and time-consuming. Always partner with other organizations. Make use of the fact that other trauma centers, pre-hospital providers, law enforcement agencies, schools, churches, and other organizations are interested and involved in community injury prevention efforts. Embrace the media. Learn to speak effectively. Be prepared for the many opportunities that will arise and allow trauma center leaders to become a reliable source for injury prevention information for local print and broadcast media. Be politically savvy. Realize that elected and appointed leaders can help if the trauma center understands their goals and the ways to work with them to create effective laws promoting prevention. And don't forget the data. Develop surveillance and monitoring tools to assess not only the available performance indicators of the trauma center's prevention efforts, but also the prevention effectiveness. Look at the data to determine where to focus your energy. State and county reports from the state of Montana and national and state reports from the CDC are incredibly useful. So is trauma registry data. All the links can be found below this video in the module. Now that you've identified an issue and done some research, you need to implement the program. Research your organization and local community organizations to determine if anyone is already working on your topic of interest. There are many prevention programs currently running in Montana. Here are a few of them. Here are some specific to Kalispell. Once your program is up and running, how do you evaluate it? It can be hard to measure the success of your activities. When you put a helmet on a kid, you are not going to be there the first time he falls, and the only thing between him and the cement is the helmet you put on his head. Again, look at your registry data to see if you're making a difference. If you started a bicycle helmet program, you may not see any change in the number of patients being seen, but you may see a difference in the number of helmeted riders, which should reduce the severity of head injury seen. Community groups receiving government funding usually keep some local statistics as well. Most of all, have fun. Injury prevention activities give the trauma program staff and the ED staff the opportunity to create positive connections with the community.